Hello everyone, so today it's an English live and we're gonna talk about Pilates and everything you want to know about Pilates with Paulette. Paulette is a Pilates teacher. She works from Restorative Movement. She's amazing. She's really good at what she does. She is the perfect Pilates teacher, especially if you are pregnant or if you just gave birth a few months ago. So she will tell us everything about what we want to know. She's really good, so and she's lost. Let me tell her how we joined the live. Perfect. Here we are. I think Paulette is here. She will be with us in a few seconds. Should be fine. So I see it again, but Paulette is a Pilates teacher at Restorative Movement. She's amazing. She's a very good Pilates teacher, especially if you give birth or if you're pregnant, and she will answer our questions about Pilates. And trust me, I have a lot of questions. Yep. So we're still waiting. Maybe we'll try again, Paulette. Paulette? Yep.
Oh, right.
Here we are. Hi, Paulette. How are you?
Not the best picture at all. Sorry, my son just walked in.
No, you're perfect.
No, I'm frozen, so I trust that I don't look so hideous as I do in the frozen photograph. Have I frozen again? Have I frozen? Can you hear me okay? Can you hear me?
I don't know if it's me, but I don't hear you very well. Better. Okay, great.
Okay. Let's try.
You're
Am I
freezing.
still?
Yeah, but that's better now. I think that's better. Can you try to say something?
Just checking that you could hear me, because I can't see myself. So can you see me?
We can see you. Yeah, absolutely. Celine, say yes.
Good. Okay, thank you, Celine. Cool.
So I say it again because you're here. So you're a Pilates teacher, an amazing one. So you work for Restorative Movement. Can you hear me? I'm not sure you can hear me.
Yeah.
And you're like amazing with pre and postnatal care. So for what we do at my French Physio, it's just amazing to work with you. So I'm really happy you're here to answer all my questions about Pilates. And we ask our patients if they have questions. So I have even more questions, so it's great, but I'm pretty sure we'll have all the answer we want about Pilates.
If not between us, we'll do just fine.
Of course we will. So can you just tell us first, what is Pilates exactly? Because like most of the time we think Pilates is just fitness, but it's not. So what is it?
So I've re-researched this. It's been a while since I began my study, and like everyone, you evolve over time. But Pilates is more than just its origin is just more than a physical movement and an exercise. Joseph Pilates was a German gentleman who was born in the late 18th century and died in the 1960s. And he was years ahead of his time in that it was more than movement. He very much believed that you use the mind to connect with the body and connect with the spirit. And in fact, reading more about him now, he was a fan of forest bathing, which is when you go, like the Japanese would, you walk in the woods to kind of cleanse your mind, to bring you back, not just to nature, but bring you back to yourself, for your overall well-being. Therefore, physical Pilates practice is really just a part of what he believed in. But fundamentally nowadays, often Pilates is just a bit like yoga, seen to be just a movement. And you can get it in so many ways. So you might, if you're lucky, be able to go to a private class with an instructor who has a variety, I'll talk in detail later, but of equipment, and you'll move through different apparatus, and a one-on-one care for your specific body. Or that can be cost prohibitive, or you might be a member of a gym like Virgin Active, and you look on your studio timetable, and after bums and terms, oh, there's Pilates, I'll give that a go. And you join a room of maybe 30 people of, now I know, varying abilities. Age is irrelevant, but varying abilities. And you're all in those environments, you all set the same exercise, which frankly, from my personal experience, do not suit everybody. You know, someone might have an injury, but they're a member of the gym, so they've got a right to go to class. It could be a knee injury, nothing to do with pregnancy. They could have had a back operation, and yet here they are in a class of 30, and the teacher, and I've been there, it's very overwhelming, and you're paid to teach, and you just think, okay, I'm just going to have to teach. Joseph Pilates had a series of exercises, so I might just, okay, today I'm just going to teach 20 exercises back to back. So you lie on your back, you lie on your front, you lie on your side, you lie on your back, you lie on your side. Let's stand up, let's sit down, let's roll like a ball. And it's not appropriate for all. So, or, you know, ideally when I teach a class of 8, usually maximum, because then I can look around the room. I've done a comprehensive questionnaire before, it's the way I work, before my clients join. I like to know everything. And because I have a strong background now in women's health, so pre and postnatal fitness, I like to really also understand the pelvic floor, any trauma to the pelvic floor through pregnancy and birth, and also potentially a C-section, and any injuries too. And then I can tweak for each person. But to do that, you need a small class. And then, for example, it might be between my classes of 15 to 20 pounds per person. But it's what we would call semi-private. But fundamentally, Pilates is a movement. I call it a movement system. Joseph himself he's quite an enigma. I think he would be a very big character if we met him today. Sorry. Kind of background, and he got himself through his illnesses through physical work. And then he also studied, he was a boxer, I think he was quite a tough guy, and then he studied yoga and martial arts. So that is why Pilates and yoga, people quite often think is similar, and it is. Like if you look at it in a gym, you look at a mat, varying thicknesses, thin to thick, you're maybe lying on the floor, or you're moving through a different sequence of exercise. But Pilates and yoga is thousands of years old, whereas Joseph Pilates was born about 150 years ago. But both do have a spiritual mind-body connection, which is manifested in a movement. So that was quite a long statement. Is that giving people a taste of what
is Pilates? And yeah. You talked about, like, I think that's what you were saying at some point about mat Pilates and reformer Pilates. What's the difference between these two?
It's a great question. And actually, again, just to reference yoga, because I know people will wonder, with yoga, you tend to just use a mat and some what we call props. So that might be a bolster, a band, or a brick to help you into position, or the wall, for example. But with Pilates, he created different repertoires. So you have the mat, which usually is a bit thicker than a yoga mat, because his traditional exercises were a lot of lying on your back, which he believed was the right way to be, to not stress the heart. And a thicker mat, because you might do an exercise called rolling like a ball, where you're rolling like a ball up and down your spine. And if you're on a hard floor, it hurts. It's not ideal.
It's not very
ideal, yeah, on your nerves and so on. Whereas, so a lot of Pilates is lying down or seated, where a lot of yoga is, or some of yoga is certainly standing poses, you know, warrior 1, warrior 2, and so on. And then you do come to mat, but you flow through it. But again, and then with Pilates, you can have a lot of apparatus. So you can have the Cadillac, the Reformer, the Wonder Chair, the Pedipole. And he actually was interned as a German man. He was interned during World War I in the Isle of Wight. And that was also towards the end of the war, is when we had the Spanish flu epidemic. A lot of parallels with today in his work, you know, these epidemics. And he helped the nursing staff. So he would take these camp beds and take some of the springs off, and he wanted the people who were confined to bed to be able to exercise, so they could take the spring and pull down and train their body or put their legs in straps. And then later this became his Reformer, and then the Cadillac, and then the Wonder Chair. So when I first walked into a Pilates center when I lived in Geneva, you look around, you're like, what the, it looks like an S. I mean, I've not been to an S, and I think that would look slightly different. But you do walk in and you think, what are we going to do here? And then they use the resistance of the spring. So a spring like you might see in a bed, a spring, and that will either be lighter or heavier, so a stronger or lighter resistance to enable you to challenge your muscles with strength. Or indeed, the lighter that the spring would be, you still challenge your muscles, because then you have to work deep within your core for balance and coordination. And then there are other things like props. So I can't see my video because it's frozen. I don't do anything. But you would have something called a circle. So we'd call this a prop.
Yeah.
And this circle, we now know, the really original ones were metal. And if you imagine a barrel of beer, because he was he worked for the pub trade as well as a younger man. Where did you get these ideas? So you squeeze the circle and you would engage, you know, I can't see my reflection, but you would squeeze here and think of a lovely long spine to really think of your core, but also your traps. And then we have different balls, which have changed over, which he wouldn't have had balls like this. Whereas nowadays, a Pilates instructor like myself, we have more training. We think of the fascia. We think of how to loosen up the body, not just by stretching a muscle, but the muscle is encased in soft tissue called fascia, a tendon or a ligament. And we can use these soft balls to work and relax the body. But then some of you will be more familiar with these softer balls here that you might, you know, put between your legs or between your thighs, and you would squeeze. And we could use this to what you would, you know, we close the chain. We think of the pelvic floor, the deep core, the breath. So as we do a gentle pressure, we can connect the mind with the body and create a lovely connection. Or we have rollers, which we might lie head to tail on, or even across the body to aid us. And then here we have the elastic bands, which again, a lot of physios would use for sure, and I know that you would use. And again, you can get different tensions in these. But what we're starting to see now is Joseph's ideas. If you think of the modern gymnasium, a gym, like, you know, Virgin Gym or your local council gym, a lot of the machines have pulley systems.
Yeah.
You might be pulling and then pulling through a weight. But then equally, you'll use these bands, which is a very wonderful portable prop you pack in your case when you go away, for example, and you can use these bands to assist an exercise, or to assist it, to help you maybe roll up the mat, but also, or you can use them just to add a bit of resistance work when you're doing your Pilates, or any rehabilitation. So we can either have mat work or we can have apparatus, which leads me into group classes, like mega reformer. So something you and I and many other people like ourselves have concern. I have no problem with, say, a Virgin Active gym. The people have joined and they paid their money and they want to do a Pilates class, and that's fine. And the instructor might be really well trained, but like I said, they're kind of put into an environment where they just have to teach like that. And they're not paid, to be honest, when they're in a gym like that, they're not paid a lot at all. They're probably paid a lot less than they would do if they came to your home. And they have to teach to one level. And then you get people who want to work hard and people who are injured. But then there's this new trend for kind of taking the Pilates principles and turning them to kind of a big gym environment with maybe 10 of these reformer style pieces of equipment. And there's a new one called Megaformer. But
didn't know that.
Well, that's what the one in Hampstead has. I think they have those equipment. And my concern there is you get injured when you are trying to take the principles of Pilates, breath work, precision, control, mind-body connection, maybe rehabilitation, and you're like pounding it up. And
No.
your pelvis is wobbling, you're gripping with your teeth, your weight is way too heavy, you're like getting tension in your neck, because when you're in that environment and you look round and everyone's maybe younger than you, fitter than you, stronger than you, been doing it longer, and it becomes this Pilates can become quite like yoga. I think it becomes quite competitive in a room. People want to do a deeper stretch, they want to show they're strong, and people are going too hard and fast, they're losing the precision, and then they get injured, and or they'll keep going back and making the wrong, becoming imbalanced, because they're working so hard that their upper traps are up around the shoulders,
Yeah.
or and what they need to be doing is relaxing down. What they tend to not get with Pilates, we want to think about for example, here I'm lengthening my bicep, but then I'm shortening it. And with Pilates, you work through the range of motion. But if you were just doing this,
yeah,
you're going to get really tight biceps and other muscles and elongated triceps. And then eventually you will get pain because your body will start to grip. And I have trained with people who are, amazing shape, beautiful bodies, and I personally like a strong looking woman, then, because that's attainable to me, than being stick thin. That's just lovely with nature. But, instructors who had the highest resistance on their reformer, and they're pushing away and their shoulders are up here, and they're saying to the instructor trainer, "Oh, I always get neck ache when I do this."
Yeah.
Because they feel that they have to be doing the heaviest resistance, the heaviest weight. And that's again not what Pilates was about. It was about having those long elongated muscles. Joseph Pilates loved looking, he was quite a character, but he said, "I love looking at animals, look how they stretch and then they come back." So you would say, like the cat to cow, you make your back and your spine into like a nice curve, and then with control you go that direction and that direction. You have to, it's like yin and yang, you have to find balance in everything you do. So does that answer the question?
Absolutely, it's amazing. It's super interesting. Honestly, there are a lot of things I didn't know about Pilates, so it's great. And let's say I never did Pilates, never at all. Should I start with a mat Pilates or?
Well, again, I think that I would have started with equipment, but when you start with equipment, the beautiful equipment is like a cushioned mat. Yeah. So invariably you lie on the reformer it's got like a detachable bit which really reveals the springs, and that's how then you physically can move the bed. But invariably you'll start with breathing work. You'll start with feeling the rib cage, and if you've got a great instructor, they'll be cueing the pelvic floor, and we'll be talking about the movement of the respiratory diaphragm with the pelvic diaphragm, the letting the tummy gently inflate, the abdomen inflate as we're inhaling. What's happening? Are we relaxed? You feel the skin melt off our cheeks, the lovely open collarbone, and you might warm up for about 10 minutes there, and then you'll get up and you'll move things. Again, its cost is prohibitive, is the truth. But I think it's invaluable for someone to start with a really well-trained, passionate person, because even if you only had 1, 2, or 3 sessions with them, you will learn so much that you will protect injury, but also you will improve any practice you have. And when I teach postnatally, so I actually only teach mat work. And that's all I'm qualified to do. So that's all I do. I don't pretend to do anything else. Since I learned my mat work, I have, however, trained in other specialities such as fascia work, using the balls, which we talk about, Franklin method, which again is a fascia-based system, but complementary to Eric Franklin. He's still alive, well alive, and complements Joseph Pilates' work. So we think about the whole body as a system. If someone comes to me with their diastasis, we have to think top to toe, because you can't help heal someone. I'll talk about diastasis a little later, the tummy separation. You can't help heal someone if they've got really bad posture, because you need to realign the posture. You need to refine the breath. So that they're true Pilates principles. And once the bones are as they should be, once the breath's flowing, they're going to feel better anyway. And then we can start to realign things. It's like trying to put up a tent. If you haven't got the frame of the tent correctly aligned, there is no way. There is just simply no way that you can put the cover on. It'll be there. It'll never heal. So to begin with, there are many talented matwork Pilates instructors out there who I feel confident saying you could start with them on the mat and you'd be great. And equally, if they had a home studio with some equipment, you could start with them again and you'd have a great foundation. But I think it's fair to say if you start in a very large group class in a gym and the instructor happens to have only done a 3-hour online course, or not, it's no disrespect to them.
No, it's true.
As you know, it's expensive. My courses are thousands of pounds. I love it, but it's an investment. And I think in anything you would do, take ownership for your body. So for me, I adore Elodie and I adore her work. As anyone who knows me, most of my clients see Elodie, whether they've had a baby or not. Most of my clients have had a baby, and no matter the age of the child, 10 years or 10 months. But you have to look at someone's qualifications, like are they qualified? And if after your first session you don't gel with your women's health physio, because that's an intimate process, or you don't gel with your Pilates instructor or your PT, it just doesn't feel right for you, they didn't listen to you, then find someone else. It's fine. I don't, client retention, not everyone who comes to me stays. I don't have an issue with that because I work quite gently. And also someone might come to me saying, and we'll have a session and they say, oh, I haven't done Pilates like that. And what they're saying is, I'm not sweating. And I'll say, okay, but, I really am concerned about I have a male client and I'm like thinking, you have a diastasis. There is no way ethically, a diastasis is a separation of the abdominal muscles along the linear elbow, which could be a long conversation in itself. As we know, it's common in women who have been pregnant, but it is equally common nowadays. It's an increasing epidemic. Forgive the parallel.
It's because we talk more about it, probably.
Yeah, but it's something that women with amazing figures in gym can get, but they are overworking, for example, external obliques and erectus abdominis. So they pull apart on this central tendon, or men can get it. And often it comes back down to bad exercise technique, as well as other factors like maybe if you're carrying a bit too much weight, or you've had a belly button piercing, things like that. But yes, I think you have to interrupt me, Elodie, because I'm just...
Oh, no, just keep talking. It's great. What you're saying, that was actually the next question I have about prenatal and postnatal, what you can do in Pilates for diastasis and everything. So that's great. You answered my questions before I asked them. So it's amazing. It's
like a flow. It's like a beautiful...
We can see you love it. Like it's a passion. You said it before. Pilates is a passion. It's not like training. You don't do training. It's all about posture and passion and knowing the body and knowing what you are doing and why you are doing what you do.
What's your intention? What is the intention in your practice? And don't get me wrong, when I started, if I give you the background, I got into Pilates because my first child, I had quite good sized babies. Like when they were born, they were almost 7 pounds. So, and I'm 5'5", so I had nice sized babies. But I had, due to the way now I know so much more, I haven't got pelvis in the room, so one of my half of my pelvis was slightly twisted.
Mm-hmm.
So every time I would try and push my babies up my vagina, they would just bounce back up.
Yeah.
Not bounce like an arrhythmic, but they came out posterior, which is a back-to-back delivery, which means that you just have constant back pain. And unfortunately for me, you push way too much, and I was allowed to push way too much. So I just pushed on my pelvic floor, and eventually I gave myself a hernia in my rectum, and I had corrective surgery for that. So it's, as we discussed, it can be quite rare. And it is what it is, but it damaged me and I had to have an operation. And I knew nothing about the pelvic floor. This is 11 years ago. I knew nothing about the pelvic floor. I didn't have a diastasis, luckily. I knew nothing about the pelvic floor, but I did just destroy my pelvic floor. So I didn't tear badly, but I kind of tore internally, is a way to think about it. So not on the perineum, but inside the rectum where your poo travels down to exit from your anus. And you don't have like a hole between your vagina and your rectum, but it's like the muscle wall has got like a sag in it. So I had all this, and then I moved to Switzerland. I had postnatal blue/depression, and I was feeling very sorry for myself. And luckily, I had supportive sister, who I think is watching now, and good friends. And one really worked hard to nudge me towards Pilates. I was like, oh, I'll give it a go, and it just captivated me because, first of all, I was lucky to join a really beautiful small private studio where it's all in French, where the women were just lovely. There was no ego, there was no competition. And I think I became hooked. So I did one group session one duo session on equipment, which is lovely to do. And you're also two instructors, only got two of you. And then I did mat work, and 2 to 3 times a week. And my breath work improved. So I obviously wasn't breathing properly. I was so tense, I was so stressed, and I was breathing properly. And when you do it, you're counting. So you might do between 8 and 12 repetitions of an exercise. So I was breathing, I was counting, and of course my figure improved and my posture improved. And then you enter this wonderful virtuous circle of just feeling better about yourself. So that's how I began. And that was really my introduction to pelvic floor. And unbeknown to me, that would have been helping my prehab before my operation, because before you have any operation, you should always do physio, because quite often, Elodie will agree, there's a lot you can do with your pelvic floor before you ever need corrective surgery. Yeah. And you might never need the surgery. And also, we're not going to talk about detail today, but if anyone watching, if you do have a prolapse, go see Elodie. But also, you can live with a prolapse for a long, long time, even with the help of the pessary supporting, for example, your uterus from beneath. But that's be another conversation, another deep topic. But I've even forgotten why we're talking about this. Breathing, the postnatal. What was the question, Elodie? I've rambled.
No idea, but you were talking about how important
pregnancy. So yeah. So the great thing about Pilates is it can be adapted. So we can work with people who have had like a knee injury, a shoulder injury, back operation, a hip replacement. We call that a special population. I've had clients who've had rheumatoid arthritis, so we have to be really careful not to stress the body, not to keep with it, working within their energy levels. Think about what's really important to them. Then, I have a lot of hypermobile clients. And when you're hypermobile and your joints are a bit too loose because your tendons and ligaments are a bit over loose, we have to have nice, strong, toned muscles and mind-body connection. And it's about not just what happens in, say, the 55 minutes with me. I'll always say, we're doing this for now for 55 minutes. But what are you doing the moment you walk out my door? Are you suddenly going slouching or overextend, letting your arm, your elbow overextend? Or are you thinking, I can do that because I'm hypermobile, but that's not going to be good for my body in the long term. So I'm going to keep my joints in nice connection, and maybe I might rotate my spine to reach for something rather than just flopping back. So hypermobility. So we can adapt. So when you're pregnant, it's really important for an instructor to be well trained. And I started initially, I think I had like a 2-hour training, which is fine, but all it did was leave me with more questions than I had even thought about. I heard the word diastasis. I thought, what the had I had a baby then? Yeah, I had to have my children. Like, what the hell's a diastasis? And you just told, don't move the torso, move the arms and legs, but that's not going to help close the gap. So when you're pregnant, you can, if you've never exercised before and you fall pregnant, wonderful, but you don't if you haven't exercised before, you don't suddenly start exercising when you're pregnant. You can continue with walking, and then you can find, probably I'd say, once you've got through your first trimester, if you've never exercised before. But when you got through your first trimester, find someone, a PT or someone like me, a Pilates instructor, who's really well trained and passionate about pre and postnatal. So they're up to date, they're current, and they've done more than 2 hours training. And they will make sure that when you train, they're not going to put you at risk, that you and the baby at risk, and not going to do crazy things that literally might be testing your balance and fall over. That's no good. Yeah. And we want to think about not just a toned pelvic floor, but a pelvic floor that can relax and open. There's no point in that, like any muscle, you know this. Again, if I go back to the biceps, no point in just pumping it close.
Absolutely.
Yeah, we don't want just closing up. We want to think about, we want to be able, can we shorten the muscle and can we lengthen it when the baby wants to come out? Then we think about working the deep core, the transverse abdominis muscle, which is like the corset muscle that wraps around the body. We want to work that muscle because we want to, that's like a corset that's going to protect the lower back and stop you getting too much of an arch. And we want the shoulders open and down, nice smile on your face. We want you to feel good. We want circulation. We want the blood pumping. We want you to feel good. We want strong legs. You might squat down during pregnancy, and then you're going to go through pregnancy, go through labor, which is however you deliver, tiring for the body. Got to come out the other side with nice strong arms to lift that baby.
Even for the delivery, if you're ready, if your body is ready for it, it's so much easier. Like if the muscles know how to work, it's amazing. The difference is amazing. So
and again, none of this I knew or did. I was quite but I didn't have like bad pregnancies, but I had tiring pregnancies, so I didn't really move. I couldn't walk to the end of the street without getting really out of breath. So I was not that big in weight, but I was not strong when I went into labour, which didn't serve me well. And also I would highly recommend that you see a pregnant person sees yourself is always a great start, because I know that you will then go, oh, I want you to see an osteopath. One of your hip joints is out, or I know that equally, if it's something you can fix, for want of a better phrase, yourself because of scarring, you would help them. And so on, and talk through birthing positions. So often when I'm working with a pregnant lady, it's nothing fancy. It's just we want nice strong glutes, nice strong quad, we want strong body, still lovely breath work, a bit of relaxation as well. And then we're talking about like moving the hips, getting them open, and so on. And I talk through, I hope you're not lifting your toddler now, because the pelvic floor is carrying a lot of excess weight, and as is the abdomen, the linea alba, the central tendon, is being stretched, as are the abdominal muscles, and it's under tension in the wrong place. So too much tension, then if you lift something like a toddler, or you think, or you get this nesting instinct and you're lifting heavy things and pushing furniture, you can give yourself a prolapse, and if you don't know, and then it can get worse, and then you push a baby out your vagina, and then you leave hospital carrying this very awkward chair, and then your toddler wants a cuddle, C-section or not, and you can I've seen women have wonderful pregnancies, the best delivery, like, you could write literature on it, and then they start carrying their baby in a sling all the time. They co-sleep, nothing wrong with co-sleeping, but what I mean more, they sleep in a position where they're not quite relaxed and they're in an awkward place. And then the baby's quite big, and all of a sudden they say to me, I've got the funniest feeling in my vagina. Yeah. So, and then I think, oh, that's a prolapse. So we talk through exhale when you come from sitting to standing, how to get out of bed properly, which I do anyway in my pregnancy classes. We talk about how to get out of bed, how to poo, you don't want to be straining, you don't want to get constipated. And if you get constipated, what you need to do to get the poo out without pushing too much on the pelvic floor, and so on. And then sorry, just children coming.
Life.
And yeah, they never leave you. And so for me, a good teacher also, especially with pre and postnatal, so it's an intimate thing. Pre and postnatal, a good teacher will never just teach in that 55 minutes and go, see you later. You need to think about supporting your client you know, being pregnant is really challenging. Having a labor is really challenging, and then having a new baby is just, it's one of the most challenging things I think you'll ever do in your life. And there are women, and brilliant, who sail through it all, and their baby sleeps, and they've got milk, you know, they're like fountains, gushing milk. Well, I wasn't like that, you know, like trying to get every ounce of milk out my boobs. And when you are not doing so well, and you see these women who are cooking dinner as well for the husband, you're like, oh my God, I'm a complete failure. And again, yeah, that's why I think finding the right instructor is key, because you'll become, you know, I've got clients now who I've gone through, you know, they've had 2 kids, and we started working together then they've gone through getting pregnant with their 3rd, and we now the baby's 6 months old, and it's a special thing. You go through it with them. But
and we always think about starting Pilates 6 weeks after birth, after your checkup and everything, but you actually can start Pilates right after birth if you have a good teacher, because like if you don't do like super strong exercises and you just work on the posture and everything, that's super important to start as soon as you can. Like it's complementary. It's not because you see a woman sells physio then you can't see a Pilates teacher in the same time.
Well, the only thing I would say, Elodie, is you can certainly start the principles of, if you feel okay and you had vaginal delivery and it was fine and you're feeling okay, you can start doing some pelvic floor work. You can think about what you're doing using all the principles of rolling out of bed, drinking fluid, you know. But what an instructor can't do is start working with someone, because we're not insured to.
Yeah. Okay.
So again, something I would say, so it could be different in France, is I have some people who say to me at 2 weeks, I want to start working with you. And I say, no, you know, no, I won't. And you should, you know, start with the principles. Think about the breath, think about the pelvic floor, you know, think about if you're going to wear the sling, how often you're wearing it when you're pushing the buggy. So you can start your rehabilitation from like the day the baby comes. But what you can't do is return to a formal exercise. It's also against the like Royal Society of Midwives and Obstetricians, you know. So someone like me, I won't be insured. And also, if you've had any tear, you really want that to heal. It's really important to not set yourself back. And with a C-section as well, you can start, obviously you can start massaging your scar once it's sealed yourself. But I fundamentally wouldn't work with someone after a C-section until about 2 months, because especially if I don't know them. And I've taught doctors, you know, and quite often even a doctor doesn't know much about pregnancy and postnatal, because they might be like a third year. And I've also taught doctors when they're pregnant who insisted that they were fine and they wanted to do everything, not my own classes when I was covering classes, regular classes. They had a pregnant woman came in, which is impossible to teach a 6-month pregnant woman with a group of other women who've been regular attendees for 2 years with no special needs, for want of a special population. And I think women need to get, some people think when you're pregnant, oh, it's nothing different, it's just pregnant. Millions of women do it, and they pick rice on the fields in some countries. Well, they do, but those women would have been fit and strong all those lives. If you're picking rice from a field, you haven't just started it the moment you fell pregnant. All your life you've probably never really sat still, used your body, squatted, moved, lunged. You can probably do a low like squat to eat for an hour, you know. That's the difference. And women need to give themselves a break. You know, you need to exercise, you need to move, do some great birth prep. Like, really important that you do some great physical birth prep, you know, like my French physio and one of your courses. Something that really gets you ready for birth, not just breastfeeding afterwards. And something connect, and that way if they do one of your courses, they connect with you before baby comes. So when babies come and they feel something funny in their floor, they know who to call. They call you, or that you've already scheduled in their appointment. Because it's so valuable for like all my clients to come to you, and I insist that they have an internal, which sounds crazy, but it's so important that someone skilled assesses the pelvic floor and checks the abdomen and like the alignment of the bones after birth. And
it's definitely complementary, because like everything else, the other muscles we don't always check because
Yeah,
unfortunately we don't have time with the moment,
yeah,
like
you
to
don't
check
see
how
the
your quad
movement.
are or your calf or whatever. So if you do Pilates and you check like the other muscles and everything, you can do it like in
Yeah,
parallel.
yeah, we can solve some of the little issues, the external ones, make sure they're squatting well. Like I've had, like I said, additional training in biomechanics, so I can assess. I'll just when someone starts to move, and then I'll tweak a couple of things because we all pick up bad habits, or we've all been told things like tuck your bum, or don't let your bum stick out when you squat, or don't let your knees go forward, or these things. And some of the rules do apply to some of the time, but they don't apply all the time. And that's again when you get injury. I mean, again, with Joseph Pilates, a lot of his clients initially were ballet dancers. And ballet dancers are one of the groups of people who have, sadly, one of the worst injury rates. And also, like, they have to all retire early because they destroy their hips. Because traditionally, a classical dancer would have to tuck her bottom and create this flat back,
Yeah.
which is really, really bad on the hip
Yeah.
joint where the ball goes in the socket. And so Joseph Pilates would do movements that we call a circumduction of the hip, where you get this lovely one leg circle that they wouldn't, although the movement's amazing, they wouldn't do it. They wouldn't get the fluid moving in the joint, or the movement that the body is designed to do by ramming the thigh muscles open. And also with Pilates, although I teach predominantly with women pre and postnatal, of course, there's a great market out. The majority of Joseph Pilates clients at the beginning were men, but now we very much see it as a women's thing, which is crazy. It's a bit like chef for men, but the women who cook at home, women cook in the house. You know, Pilates is for everyone and can be for rehabilitation, enhancing sports performance, like I said, special populations like rheumatoid arthritis, hypermobility, something called EDS. If anyone's watching, they'll know what that is. Ehlers-Danlos syndrome, where you get this extreme hypermobility and fatigue and pain sometimes. And we can use Pilates just in its true modality to really strengthen people. I've helped women who've had breast cancer surgery. You know, again, there it's about getting the ribs moving. Pilates reaches you in a way that other movement won't. So when you go to a gym, gym's great, gym is great, and if it makes you feel good, it makes you feel good, phenomenal. But really, you don't think about breathing and expanding the ribs and rotation of the spine, translation of the spine, you know, whole body movement. What's the cervical, the neck? What's that spine doing? Where's the head placing? Where's the breath? Where's the pelvic floor? You just lift heavy. And again, with diastasis, with the women, we're seeing this proliferation in, for example, there's nothing wrong with CrossFit. There's nothing wrong fundamentally with any exercise if it's done well. And the moment you start kind of really challenging the body, like marathon running, oh, it's great. Oh, yeah, we're all designed to walk for miles, but yeah, but not kind of as a fitness thing. We're designed to walk for miles thousands of years ago to find food. You know, it was a different thing, and we would walk and rest and walk because we'd eat berries as we found them, you know, and so on and so forth. It's just proliferation, and that's why women are getting diastasis nowadays, because they are overtraining their six-pack muscle and their external obliques, and the body just has a point of when, you know, the tendons will want to be able to like move and stuff, and then if they're pulled, eventually they're going to get little tears, and if you're unlucky, you get that big movement of a diastasis recti, the separation of the linea alba, where you get like pressure control here. And also with, as you know, with pelvic floor, you know, you shouldn't be wetting yourself. If you've just had a baby, it's not going to shock you. It's not going to shock me if I have a client who's 3 months postnatal and has a little dribble when they have a good laugh on a full bladder. You know, that's not a shock to me. But then we need to work out why. But a woman in her 20s who's never had a baby and lifting heavy in the gym, if she's wetting herself, it's a sign to me that it's too much for her body, but it's seen as a badge of honor, you know. And unless you are an Olympic, I mean, someone who really is going for that highest level of training, you shouldn't be sacrificing your body.
Absolutely.
But, you know, people can choose to do what they want, but in the long run, you know, you've got your one body for life. You don't want to do so much damage that when you're 90, or, you know, you have to have surgery for incontinence, because it's
Yeah,
just
but you don't think
not
about it when you are in your
90.
90s. You
Yeah,
want to do your best, and then you realize 2 years later, oh shoot, what did I do?
yeah, yeah. And you want to be pain free. Movement should make you feel great. You shouldn't be in pain. I mean,
Absolutely.
you might have a few achy muscles if you've challenged yourself. There's nothing wrong with that, but you should be able to walk. You know, people go, oh, I can't walk today. I went to the gym yesterday. Like, why did you get hit by a car on your way home? You know what do you mean you can't
Yeah.
walk? You should feel energized and invigorated and moving well and not have headaches. And
Yeah,
you know, I love physios, and obviously there's a reason why like a physio like yourself exists, but in theory we shouldn't need all this support. We shouldn't need to be
absolutely.
put back together.
Yeah,
We should just be, obviously there are definitely times you have a fall, you slip, you know, your jaw muscles, you're gonna, or childbirth or an operation, but we shouldn't be like
ah,
some clients seeing an osteopath once a week. And I think,
absolutely.
well,
Yeah,
yeah, why?
yeah, it's crazy.
Yeah. And like the money they're spending on an osteopath, say £70, they could spend that £70 on a really nice session with me. But like,
Training,
or,
absolutely.
yeah,
Yeah,
getting an hour's movement in that will eliminate the pain.
yeah.
It's like a win. It's like it's a win-win. And I've got so many notes, so I'm just going to scan them because so just to say, one thing we didn't talk about is when you're pregnant and you're doing any exercise, you know, if you have an exercise before, you shouldn't start until the end of your first trimester. If you're already exercising, continue exercising if you feel well. Continue exercising, but do not increase your load. That's just a time to maintain. And you should always be able to talk, you know, like if you've always been a runner and you want to continue, but you should still be able to have a conversation. And but the moment you, for example, if you start to feel, oh, anything heavy in your vagina and your pelvic floor, it's a sign that you're not managing your pressure systems. It's not even, is it, Elodie, that we have to say, stop. Oh my God, stop. It's go see Elodie. Go see Elodie, let her assess.
Right.
Because I know that recently, well, obviously not name names, but recently you worked with an ex-pro athlete who is really strong, knows her stuff, but had never seen a women's health physio. And just after that one session with you, to quote her, she said, my vagina feels so much lighter. But in all the years that she had moved and been fit, she never knew that such a women's health physio existed, despite having years of physio and, you know, osteopath training and so on. So it's really something that any person who loves doing sport should come see someone like you. And also we really don't like women lying on their back during exercise after 16 weeks. You know, it's 16 to 20 weeks, depending on which country you're in.
Yeah.
And that's because we know that invariably we say if the woman feels faint, so she gets a bit dizzy. So we want the head and the shoulders above the pelvis. So I can lay my lady on a pillow. So her head and shoulders are above her pelvis. So we can keep the blood moving and not have the weight of the baby and the pushing down. Because we always think, well, if by the time the mum feels a bit faint and dizzy, what's happened to the baby's oxygen supply? But there is so much you can do with a client, and I don't like clients doing, you know, lots of flexion, which would be crunches and ab work and sitting up. Ab work, as we know, is vital, but we want that deep core work, and we can
one.
a good one, and we can do that on all fours. We can do that sat up. We could do it standing, but we don't do any sit-ups, as it were, because they don't serve you during pregnancy. And if you've got 55 minutes with a client, there is so much you can do. So people think, what? And another instructor might think, oh, but what would I do? I always do 10 minutes of ab work. You replace that with maybe just thinking of like deeper core work, but also like lengthening and opening the pelvic floor, some nice releases to just lengthen and open the pecs, that sort of thing. There's always so much you can do. There's no it's limitless, or you know, pelvic tilt's always good.
No, what, Paulette, it's amazing. It's just like, it's a lot of information and everything, but like I think what we can remember is you need to find a good Pilates teacher, if you are in London, definitely you, especially if you're in North London. So your Instagram is Restorative Movement.
Yes.
Okay,
Restorative Movement. And then my email is Paulette, French name, Paulette, Paulettete at restorative-movement.info.
We will write it down in the.
Thank you. Yeah. I'm just again scanning my notes.
Yeah, sure.
Like, because I like to be thorough. Yeah, so when you're pregnant, you don't want to do crunches. You don't want to lie on your back with both feet in the air. Again, it's a lot of pressure through your pelvic floor. And if you've already been lifting heavy, you know, for years, then you can probably continue. But you need to be able to manage your pressure systems, your intra-abdominal pressure, which is men and women alike have this intra-abdominal pressure between the pelvic floor and the diaphragm, and then wrap the abdominal muscles wrap around to kind of hold it in. And if you go on YouTube, you'll see, if you like Google like pregnant women lifting weights, quite often, sadly, you will see that the women, amazing as they are.
Yeah.
I'm not saying that I think they're incredible, these women, but they have a diastasis. And I can't remember, there is one woman who she lifts heavy, but she very heavy, but she knew how to manage her intra-abdominal pressure, and she eased off the heavy weights. She used her breath work, and then she had her baby. Yes, her whole body had softened up. You could see she was muscular, she softened up, and she followed, I can't remember, you'll know, the lovely American Physio. I can't remember, she demonstrates with the balloon. My mind's gone blank. But she then waited her 8 weeks, and then she gradually got back into fitness. But she gradually did it under the guidance of her women's health physio.
I think it's Julie.
Julie, WEIBE. Like, if you are lifting heavy and you're interested, just do it with the guidance of women's health physio. Or I don't do PT. You know, there will be a PT out there, physio called personal trainer, who helps women in pregnancy lift heavy. But it's always, as you know, Elodie, you're watching. With my clients, I'm very hands-on. You know, ask, may I? Or it's different. Like with you, you're feeling internally, and you're always looking. I've watched you work. I know you're feeling and you're looking. But like for me, I've got my hand on the abdomen, because I'm just feeling for any little changes along the linea alba. And then also, I'm saying to them, this is the Pilates principle: are you paying attention? What are you thinking? And when you get someone in the correct position, you say to them, put this in your memory bank. This is the correct position. What does it feel like to you? You know, it's taking ownership of your body, and checking that when they're doing things that create pressure, this pressure system, that they're not going, their body will look, it's like the body looks for the weakest link in the pressure system. So like a little tear, you know, so when your bicycle wheel deflates, it's because the pressure has gone through the tear. And although your skin's not torn, your body's feeling to find the weakest link.
Paulette, the live will stop by itself.
Oh,
in 1 minute.
Okay, you
there was a end for the live, sorry. Thanks Instagram. So we can start another one, but like actually I think 1 hour is already good.
Oh my God.
You talk for 1 hour.
No,
you told me like 10-15 minutes. No, I can't do that. I will talk much longer. So you did it. So definitely, if you want a good Pilates teacher, go to see Paulette. She's amazing. Do you do a Zoom consultation? Like,
I can. I mean, I always chat with people. I can happily chat with people and chat that we're right for each other, for sure.
Okay.
If that's what you mean. I'm happy to talk with people. And on my website, I've got loads of information. You know, if you email me, I'll send Paulette at restorative-movement.info. I'll send you my PDF on, you know, postnatal healing, which includes food. You know, it's like that one-stop Bible, or like PDF, like a mini leaflet on how to get well. Yes, I love it.
Perfect. So yeah, and definitely once the lockdown is over in London, go to see Paulette. Yeah, at some point. So let's do some Pilates. Pilates is great. I always say that to my patients. Like, if you need to choose something during the pregnancy, like do some Pilates. It's great. It's great for the posture. It's great to work on your abs. It's complementary. Women's health physio is great. It's great to see one. It's great to get ready for the birth, but like with Pilates, you do 1 session every week, 2 sessions every week, and it's like it's a routine, and your body learn what to do and how to do it properly. So it's much more, it's not better, but it's complementary. Like you can't say, okay, I don't need a woman's health physio because I do Pilates, and you can't say I do Pilates so I don't need a woman's health physio. So like, do Pilates. Pilates is great. If you have to choose, it's great during the pregnancy, it's great after birth. Sorry, like it's great for every injuries, but like our followers on Instagram are pregnant or postnatal. So it's just amazing. So do some Pilates. It's amazing for your posture, for your abdominal muscles, for your pelvic floor. It's great for everything. So go to see
your mind, and you know, when you've had a baby, you must take time to yourself. And you bring the baby to my classes anyway. That's really, I'm very good with babies, but it's also, you're giving something to yourself. You're investing in your future, and you'll feel better. And the sooner the better, always, you know, as in 6 to 8 weeks. And then, but even 10 years later, that's fine. But do something and do it for yourself, and you will feel great, like I did. It just heals the mind, the body, and the spirit. And I'll nudge you in the right direction. I'll check you're not drinking Coca-Cola and coffee all the time. You know, simple things to make you feel better quicker.
Absolutely.
What we need. Women should support each other, and we do, so that's great.
Yeah, definitely. Okay. Thank you very much, Paulette. Thank you very much. That was amazing. It was a great talk. Like, people say thank you, so thank you very much. It was very nice to do that with you. I'm very happy we did that together.
Thank you.
And hopefully we'll see you properly soon.
Coffee. All right.
Have a nice weekend, Paulette. Thanks again. And we will have the details, the link for Restorative Movement on the comments. So just have a look at it and go to see Paulette if you can.
Okay. Be well, everyone. Thank you, Elodie. Take care.
Thank you very much, Paulette. Bye.
Thank you. Bye. Bye for now.